Hi everyone. We're just gonna give another minute to the newcomers, and we're then gonna start the webinar. Thank you. Also, in the meantime, if you wish to introduce yourself in the chat box, we welcome it very much to know who's in the room. Thank you. All right, so it's 10:02, and so just for the sake of time, I think we're going to kick off the webinar. Thanks again to everyone for being here. As some of you might know, and who had the chance to attend our first two webinars, this is the third webinar of this series. Yeah, more specifically, the Red Crescent Menstrual Hygiene Management Experiences webinar. Before introducing to our amazing speakers who are here today with us, just a few housekeeping rules. As you know, we would like all of you to keep on mute just for the sake of not having any background noise. But of course, if you want to send any questions throughout the presentations, please feel free to do so through the chat box by selecting to everyone. Questions will be shared at the end of every presentation. You will see that we are going to keep space to 3 questions at the end of every presentation. But if we have time for more, we're going to definitely post them and have them at the end of the webinar. Finally, we are going to run some polls throughout the webinar, as you're going to see. You can also move the question if you want to answer it later, but these are very quick polls that you can answer in really like 30 seconds. So we would really encourage you to answer them as soon as you receive them. So for the agenda today, we have a very interesting agenda. The first presentation will be presented by Sahar, who's joining us today from Karachi, from the Aga Khan University in Pakistan, and she's going to talk to us about promoting improved MHM in rural Pakistan through community champions and MHM corners in hospitals. There's then going to be a poll with the Q&A session, and then we're going to give the floor to David, who's joining us from Kampala and who's with the International Rescue Committee. And he's going to present on the menstrual disposal, waste management, and laundering in emergencies compendium. Finally, after the second poll and the Q&A session, we're going to give the floor to Simon, who's joining us from Beirut. And he's going to tell us about a user-centered approach for local adaptation of MHM kits and education material in the Iraqi context. We're then going to have another poll, the Q&A, and some conclusions shared. Again, if you want to raise your hand throughout the webinar because you want to do a follow-up, please feel free to do so, but always stay on mute and ask questions in the chat box. So before starting the meeting, I just wanted to present you the speakers that we have today. We're very glad to have them on board. So the first speaker is Sahar. Sahar is a public health professional and works as a manager for quality assurance and coordination at the Aga Khan University in Pakistan for a Swiss Red Cross funded project. She has more than 10 years diverse experience in social development, encompassing also health and community development programs. And she's currently implementing the third phase of a project that also focuses on interventions related to MHM and safe drinking water. 𝗖cie, who's also going to join us from Iraq in Sinjar and is going to co-present with Simon, is working in the humanitarian community since 2016. She joined French Red Cross as a WASH officer in 2019. And now she's working as a WASH deputy project manager, serving the Sinjar community with MHM sessions in schools and within the community. 𝗖cie and her colleagues are pioneering as well the adaptation in Iraq of the IFRC guidelines of MHM in emergencies. Then we have David. David is a WASH technical advisor with the International Rescue Committee. His role is to support and ensure program quality in IRC's water sanitation and hygiene projects in different countries, among which Afghanistan, Pakistan, Nigeria, Bangladesh, and elsewhere. He has conducted extensive research and training in menstrual health and hygiene in his role at IRC. And amongst others, he's also co-author of the compendium on MHM in emergencies and MHM compendium of solutions that he will present to us today. Finally, Simon is a WASH technical advisor for the French Red Cross. He is based in Beirut, and he's mostly following the emergency responses in the Middle East. His focus is to develop and improve methodologies to increase the quality of the aid proposed and develop volunteer skills. And since 2018, with his colleagues from Iraqi Red Crescent Society and Syrian Arab Red Crescent, he continues to find solutions for making menstruation a normal, safe, and healthy event for girls and women in the region. So as you see, we are very glad to have these very knowledgeable speakers with us today. Finally, before starting the presentations, I would like to give the floor to Adrian, who today is co-moderating the webinar with me. Yeah, Adrian, the floor is yours.
Thank you, 𝗖cie. Good morning, good afternoon, and good evening to everyone. Thank you for joining the webinar. My name is Adrian Dongas. I'm the Global Menstrual Hygiene Management in Emergencies focal point for UNFPA and UNHCR, offering a pair of hands today for the great sessions that have been done so far by both 𝗖cie, Alex, and everybody else in the team. I'm very excited to see what the speakers have to share with us. And please also, if you happen to have any comments about the work that we're doing with the Global MHM and Emergencies Working Group or anything else related to MHM, please do ask so in the chat, and I look forward to engaging with all of you.
Perfect. Thanks, Adrian. So just a few words on myself. For those that managed to attend the first two webinars, I am working with the IFRC WASH team. More specifically, I'm supporting the WASH team in implementing hygiene promotion and menstrual hygiene management activities, both in emergency and in long-term contexts. So enough with the introductions. Before giving the floor to Sahar, we're going to launch a quick poll to know who's in the room. So please answer the questions that just popped up on your screen. And we're then going to present you the results. Thank you.
Great, so I'll give it another 10 seconds. Basically, the aim of this poll here is to make sure that we get a sense of who is in the room, what sectors are represented, and also for future webinars to make sure that we maybe reach out to some of those sectors that are not with us today. So I'm going to end the poll now, and you should see the results. WASH, very, very strong presence today. Glad to see a lot of health colleagues here as well. And I guess for future meetings, maybe we'll try and find a few more protection and gender and inclusion colleagues to join us. But welcome to everyone. And please do share the webinars with all of your colleagues to increase the participation. I think we can go to the first presentation, 𝗖cie.
Perfect. Thanks a lot, Adrian. So Sahar, whenever you're ready, The floor is yours.
Thank you, 𝗖ecie. Good morning to all. I am thankful to IFRC for providing today's opportunity. I'm Sahar, and as 𝗖ecie gave my introduction, I work at the Aga Khan University. Today, I'm going to present a case study on promoting improved MHM in rural Pakistan through community champions and MHM corners in hospitals. This case study is based on a community-based initiative to address menstrual hygiene management needs of adolescent girls and women in Sindh, Pakistan. This project is being led by Dr. 𝗖cie his𝘁𝗲𝘁, who is a professor at Pediatrics and Child Health and Associate Director for Center of Excellence in Women and Child Health at the Aga Khan University, Pakistan. And I also look after this project as Manager Quality Assurance and Coordination. So next, please. This MHM intervention is part of our main project titled as Strengthening Maternal, Neonatal, Child and Adolescent Health Services, which is being implemented in collaboration with the Swiss Red Cross. The goal of this project is to contribute to an improved MNCH status in District Dadu, Sindh. Through this project, we want to achieve outcomes like quality of health services, improved quality of health services, and improved access to health services, and improved health behavior in the target communities. Next, please. The project is being implemented in District Dadu, which is part of Sindh province, and it caters to around 100,000 population, which is low social and economical area. Next, please. So initially, we conducted a baseline research consisting of qualitative and quantitative methods, and through this qualitative method, we tried to explore the perception, practices, and preferences of the community regarding menstrual hygiene management. This had included focus group discussions and IDIs. We conducted these activities with women and men and adolescent girls in the community. So the key findings we achieved through this qualitative research were like menstrual flow is seen as dirty blood and a matter of shyness, hence creating hesitation and avoiding discussion on menstruation, even asking and even not asking for the help while in need. More than half of the women, including adolescent girls, were not aware of menstruation before onset of menarche. Similarly, most of men came to know about menstruation after their marriage from their wives. However, majority of husbands shared that they do have discussions with their wives when they face any menstrual issues. We also find that mostly women used old clothes as sanitary absorbent. It was astonished to note that some women don't use anything for protection during menses, mentioning the reason that it may stop menses or cause abdominal bloating. Almost all women have knowledge about commercially available pads, but they preferred using old clothes or used nothing because of non-availability of material around or lack of access to the market and non-affordability. All participants were very much concerned for not having enough privacy while washing, drying, and disposing the sanitary material. Thus urgency causes the unhygienic practices. Next. So findings from the household survey shows that mostly respondents had the opinion that young girls face problems at occurrence of menarche. Menstruation affected to social life of 74.6% of women. Of these, 26.8 stopped going outside of the house. Around 40% of menstruating young girls and women don't use any absorbent. Among the users, 30.9% used reusable material and 28% were using disposable type of sanitary materials. 13% took a bath after period is over. 45.9% women were avoiding the intake of certain foods. 84.9% of uh, participants were in favor of providing prior information to the young girls in advance. Mainly mothers were source of information. Some suggested that teacher or school should be providing this information to the adolescent girls. Next, please. We had also conducted the knowledge and scores analysis. We find that the mean score of knowledge and practices of the respondents were less than 50%. So after this overall score analysis, we also compared the score between adolescent girls and women. We find there was a significant difference in mean scores of knowledge between adolescent girls and women, while there was no significant difference of practices between the two groups, maybe referring to the same situation they live in. Next, please. Keeping in view this baseline situation, we had designed and implemented the MHM intervention, and our approach to this uh, uh, and our approach included awareness group session, mainly providing knowledge and information, skill development through practical ped making sessions, MHM corners. Those were established at healthcare facilities and managed by healthcare providers, and MHM champions, like inclusion of knowledgeable and skilled local volunteers of MHM. Next, please. Given the taboo surrounding MHM, women in Pakistan are unaware, lack comprehensive information, and continue to have unhygienic practices. They are too shy to talk about menstruation or to share about their menstrual health issues or needs of menstrual hygiene management. Hence, we aim to enhance the women's and girls' knowledge through awareness group sessions by a trained cadre of public health professionals, including men and women. So we trained around 25 public health professionals. Those were community health workers, females, and community mobilizers, men. And we also trained to the 4 medical personnel who are placed at the hospitals. So through the awareness session, we reached around to more than 20,000 adolescent girls and women. Next, please. The awareness sessions were conducted using the behavior change communication material, mainly adopted by IFRC and developed by AKU according to the local context. Topics included biological aspect of menstruation, menstrual cycle, normal duration of menstruation, age of menarche, healthy and hygienic practices related to washing and caring of reusable pads, drying, storing, and safe disposal of the used sanitary material. We also addressed myths and misconception during these sessions, which are prevailing in the community related to MHM. Next, please. Our approach included skill development by teaching to prepare cost effective, easily accessible homemade reusable pads, followed by the awareness session. Practical pad making session were organized. Each participant were provided a set of clothes, and that set of clothes included one cloth piece for basically making this pad cover and six pieces to be used as absorbent. The material was chosen through a procedure including like assessing the market and shortlisting the materials and try those with the local community members and collect their feedbacks, and then we were able to finally select the material. As shown in the pictures, you see in the middle picture snapshot from a pad making session where women they are tracing a paper pattern on a cloth and cutting it for further sewing through machine or by hand. So on the left corner of the picture, you see the first pad model, And this pad model, this is the original pad model that we have conceived while we were implementing this project. As the pad making sessions began taking place, the team came to know that neither mostly women use underwear nor it is easily accessible to them. So we designed a revised pad T model, as you see at the right corner of the picture, titled as pad T model. So this is a combined form of reusable pad and underwear, preparing the pets for their own self in in a group work, and it is a way to more comfort and openness towards MHM and motivation for adopting improved ways of maintaining hygiene. These pet making sessions were also helpful in identifying influencers or MHM champions. Next, please. Through pet making sessions, we had reached to more than 16,000 women. So through these sessions, MHM champions are identified. They are local volunteers, the most active and skilled participants who can play a key role, model influence and enable for improved MHM in their respective communities. As you see on the slide, we have our one champion, Sakina, 45 years old. She is a shopkeeper but very active in the community, and she has come up with the idea to prepare these pads and sell at her shop for the women who are in need. And at the left side, you see our very young champion, Rubina, in the red scarf in the middle. She is just 19 years old. She came up with the idea to invite her peers at her house and discuss the good practices of MHM and prepared reusable pads. And also you see our MHM champion Aziza. She is a tailoress and she also teaches sewing at her house. So she solely conducted a session with her students to prepare these reusable pads. Next, please. We have set up MHM corners in 2 tertiary care hospitals in district Dadu. These corners are safe space where information and counseling is provided to the women who are visiting healthcare facilities by trained healthcare providers. Next, please. While working in the community, we did not want to miss the opportunity to engage with men on MHM related issues because access to markets to avail sanitary material, economical support for affording sanitary materials, seeking health services of menstrual health issues, and safe and convenient facilities and disposing systems at household and community level are key concern of women, and which requires a men's involvement, keeping in view the ground reality. So to provide these supports, it is very important to engage men in MHM from the starts. Next, please. Um, and here on the slide, you see some links. So where you can find the baseline survey report. We had also conducted a consultation workshop on menstrual hygiene management. You can see the activity. Also, the video on MHM is also available through web link. Thank you very much. Thank you, everyone.
Thank you, Sahar. This was really super interesting. I think we're gonna proceed now with the next poll and then go to the Q&A session. I know that there's a few questions in the chat. So let's answer this question and then proceed with the Q&A. Thanks.
Great. So I see about 30% of you have answered the poll. Please take the time to do so and think about which of these interventions, if you could pick only one, you would pick to adopt in your own programs. Just give it a few seconds longer. for the last people to enter. All right. So it's quite interesting to see the MHM education for boys and men is actually leading. So it seems that there is a real desire to engage the wider community, to engage men and boys in your programming as well. But also the MHM champions are doing really well. So yeah, I'd love to see if maybe some of you will adopt this in the course of the next year. If you have any questions around how to approach it, I recommend to reach out to our presenter. And with that, I think we can move on to the questions. 𝗖ție, do you already have a first question from the audience that you want to share?
Yes, thanks, Adrian. So I see there's actually quite a few questions. The first one, Sahar, is from Alex from the Austrian Red Cross that asks, which problems did the women and girls that did not use any pads report? Thanks.
So thank you. So mainly there were myths and misconception, and second, there is poverty. So most of the women think that if they use any absorbent, it will stop the blood inside the body, and it will also cause, bloating of the abdomen, and the blood which is supposed to be excrete out, it will remain inside. So they had this misconception. And the other thing is poverty. So if they don't have anything to use, so usually they don't have. Those were the reasons.
Thanks, Sahar. Then there's a question on the research itself. So how is knowledge and practices score estimated?
Yeah. So we have used around 10 domains of knowledge, different questions, and we did their scoring category by 1 and 0 to the acceptable answers. And we also used around 8 variables for measuring the score for the practices. And then overall analysis for the participants was prepared. Thanks.
I see another interesting question here coming from Wash United. I assume that's Ina. And the concept of the MH corners in the facility, the health centers. It's a really interesting one. And the question really is that model replicable and scalable? And have you done so already? And have you shared this already?
So this was the first time that we implemented this MHM intervention and the MHM corners that we established in the health facilities. So initially we had established in one hospital, which is subdivision of the district, and we find a very good response of the participants there, especially the women who were in their postpartum period. They were being visited by our health staff from the corner to their beds, and while conducting these awareness key messages, they were very happy upon getting visits from the district health officers of the government. They appreciated it very well, and they further asked this project to establish another MHM corner at a bigger level health facility, which is at district level, called DHQ hospital. So after the successful implementation in one hospital, we extended it to the another one. Thank you.
Thanks, Sahar. I think there's also another question related to the reaction of men that were involved in the session. So more specifically, how did men respond to attending such sessions, and were there any challenges? And related to this question is, were also the curriculum, trainer, and training materials tailored for men participants? Thank you.
So engaging the men in MHM intervention was also trial for us. So first of all, we had the challenge of training our own men staff. We had around 10 men mobilizers, and we had around 25 women healthcare workers. So we had to train them on MHM, and MHM training requires more in-depth knowledge. So while we had this challenge that shall we go together, we should keep them together for the training purpose, or for we should separate them. So just to break the taboo at our own side first, we took this initiative and we did a combined training, keeping our men and female participants together, and we found it very professional, and we found our men's response towards it, like it was very positive, and they understand the importance, and even women were comfortable having training together, and they all understood the situation and importance of the topic. While going into the community and engaging men was another challenge for us, and we were not sure that we will be able to really conduct these sessions with them. But surprisingly, when we started talking about this, we find no major reaction from the men. They were initially, we find them like less active in the sessions, but they were open to listen it and understand it. So we were able to engage like more than 5,000 men through these awareness sessions. So it was very interesting activity, and they had some comments like it's women topic, women's issues. So we tell them that yes, we are engaging women with the women also at the household level, but it is also important for us, for you to listen and understand as husband and a father, and to provide them support in time. So they were quite receptive towards it. Thank you.
Thanks, Sahar. This is indeed a very, very important point. So I think we're going to stop the Q&A session here. I know there's another few questions, but we'll try to answer those at the end of the webinar. So to continue, I'll give the floor now to David.
Great, thanks, 𝗖ecie. I hope you can hear and maybe see me. I switched on my video for a while just so people can see who I am. Yeah, hi everybody. It's great to be part of this forum. It's really interesting to participate, and also great to have the opportunity to present to you all about some work that we've been doing. This is a collaboration between International Rescue Committee, IFRC, that I work for, and Columbia University's Mailman School of Public Health. Many of you may know Mani Summer, Maggie Schmidt, and Caitlin Gruer, who at Columbia, who've been very active in the menstrual space for many years. It's really great to work with them. We were the same team who developed the MHM and Emergencies toolkit back in 2017. It was launched. And so this project, which was funded by the US government, really grew out of that project. If we can go to the next slide, please. Yeah, so I mean, a sort of core concept from that toolkit is really that any humanitarian response and MHM should have all three of these three basic components that we need to have to make sure that women and girls have access to MHM materials and supplies. We need to ensure that menstruation supportive facilities are available, and also that they have access to information about the supplies and how to use them, but also sort of reproductive health and information about their bodies and so on, especially for adolescent, pubescent girls. And so, these three components, we can't neglect any one of them. The subject of this compendium that I'm presenting on today really, it crosses across these three components, and it has a component in all three. I mean, I think sort of stepping back a bit, we've seen a lot of progress in the menstrual space of humanitarian response over the last several years. We've gone from a point where, menstruation was not really ever mentioned or was taboo to talk about, to really far more acceptance and acknowledgement of its importance in humanitarian response. And I think that those taboos among humanitarian workers, among male staff especially, have really been knocked down. And I guess sort of among women as well, in terms of speaking about menstruation. But I think where we do still see a much higher level of taboo is when dealing with used menstrual materials. When they're still in the packet and nice and pristine, then it's okay to handle them. But of course, once a material has been used or quote unquote soiled, then that becomes far more embarrassing and taboo and sort of much more need for secrecy. And I think that despite the progress made in MHM, managing used materials still remains kind of understood, I guess, about how to best deliver humanitarian programs that can allow women and girls to manage their materials comfortably and with discretion and with dignity in the constrained environment of a humanitarian context. If we can just go to the next slide, please. Now, these are just a few quotes that we picked up along the way in visiting different emergencies and talking to women and girls in different places. I just want to focus on the middle one and read that aloud. Once a volunteer found 4 pads in the latrine. He accused me of tossing them there and reported me to the Maji. I swore in the Quran that I did not do this. The volunteer then came to my house with the used pads in a bag and requested I bury the materials properly this time. I was so ashamed. And so this sort of shame and embarrassment, we come across a lot, and it's, it's obviously another challenge for women and girls in humanitarian contexts. I mean, I think also worth noting from that quote that, the good solution was to bury the materials, which is in itself problematic, especially in Cox's Bazar, where it's hilly and there's a lot of rain and erosion and so on. And it's not a great and very crowded. So clearly, even the good solution is not a good solution there. And so, we do see that these issues really do create widespread difficulties for women and girls in humanitarian contexts, and we do have some way. I mean, NGOs still and IOs, I think, still have some way to go in presenting and in just solving this and providing a good set of solutions that just make this easy for women and girls to deal with on a month-to-month basis. And so the gaps. Next slide, please. When we were developing the toolkit, at the conclusion of that process, we really felt that gaps where we still just didn't have enough programming knowledge to give good advice were in examples of culturally sensitive menstrual disposal options, strategies for managing menstrual waste once it's been disposed, and then what are the supplies and infrastructure needed to support girls with the washing and drying of reusable materials. And so that's really what this compendium was focused on. Can we go to the next slide, please? And so if you look at these are the chapters of the compendium, which I'm going to go through very briefly today. I don't want to present, the results, because really, I mean, my aim is hopefully that you will, download the compendium and sort of read the full thing. There's more information in there that can be presented in a 15-minute talk. And I think, we wanted this to be a collection of what other organizations have done, what the knowledge is in the field, because I think, especially with MHM, one of the best ways of learning is learning from others and learning from their successes and their failures, and not repeating those failures, but certainly trying to emulate their successes. So learning from others is critical, and that's why we went for a compendium form, not telling people what to do, but sort of presenting what others have done, in the hopes that people will will learn from that and design their own programs on those bases. So these are 6 chapter headings, which I'm going to just go briefly through some of the key points from these, just to help, hopefully to interest you enough to download the document. Starting with the first 2 about consultation and female-friendly toilets, if we can go to the next slide. I think that consultation is really somewhere where we did find quite a lot of innovation and new ideas and so on. And so these are a few photos from different projects that we either visited or heard about, or people sent us information on and so on. We were quite active in trying to reach out to organizations to learn what they were doing, even if we couldn't physically visit. And so we're seeing model when it comes to design of facilities and discussing what facilities should have engagement with women and girls and with men and boys, which could involve creating cardboard models, creating Lego models, working with smartphones and bringing technology into the process to help people visualize and help people interact, and then paper-based methods, but really learning from women and girls what they want, what they need, and using that in the design process, in our program design process, is obviously is critical and is acknowledged as being a need, but we are seeing more and more kind of innovation and fresh thinking in that space. And so one of the components where that's really important is, if we go to the next slide, which is about menstrual disposal, the 4 elements. You'll see at the top, discrete design is really important. And again, as I say, consultation is so important in making sure that we understand what women and girls need in a particular context, and that our menstrual disposal approach responds to that. And I think a fairly clear learning is that when it comes to disposing of used pads, it needs to be discreet. People don't want to be seen throwing away pads. They don't want to be carrying them through the settlement and so on. And so thinking about how that can be done easily, safely, discreetly is an important part of any menstrual disposal system. We also need to think about how this will be maintained, who's going to empty the bin, etc., and how is it going to be kept clean and managed going forward on the long term. And then, what happens to that waste after it leaves the bin? What is the final point of disposal? And then the 4th component is communication. If women and girls don't understand the systems that we're imposing or don't know how to use it, then that's not going to work well. And of course, it needs to be two-way communication in terms of learning back from them about whether it's working or not. So going back to discrete design, if we can go to the next slide, we found some good examples from the field, various places. I mean, because as I say, discretion kind of dictates that ideally there should be a bin inside the cubicle, so that so that people can dispose of it where they can't be seen. And so we're certainly seeing innovation around that, about what's needed, and about increasingly having bins in cubicles, which was, I think, fairly rare in the past. If we can go to the next slide, there's also interesting innovation around, rather than having a bin, having like a pigeonhole, just a hole in the wall which you can dispose a pad into, and basically have it sort of disappear. You can see the hole is immediately underneath the sign in the picture on the left. And the idea is that then there's a PVC pipe sloping away, which allows the pad to just kind of slide away into a sort of concrete vault, which can be emptied at long intervals. But basically, this is discrete in the sense that the pad is not accessible to people after you've disposed of it, which is often a concern. We also, if we can go to the next slide, we also saw a similar approach elsewhere in the Cox's Bazar area. This was an MSF hospital where they put in also a sort of pigeonhole type chute for disposing of menstrual materials. This one going into a red bucket, though, rather than a vault. Bearing in mind that this is a hospital, it has a waste management system with sanitation workers and an incinerator on site and so on. So in this case, it was very easy. It was easy enough for them to empty that bucket daily and to incinerate menstrual pads along with medical waste that gets incinerated on a daily basis anyway. So that works well in that situation. So these chutes, I think, are an interesting sort of innovation, which I think is slowly gathering ground as an alternative to a bin. Obviously, what happens next, the waste management side is important. What happens after it's in the bin and so on. If we can go to the next slide, certainly, these are examples of community level incinerators, which certainly give the advantage that women and girls know what the final disposal point is. I mean, they know that the pads are being destroyed. So incinerators certainly have challenges as well, but certainly there's innovation around this, or experimentation around using incinerators at community level. Again, it's just to bear in mind that in your programming, if waste is going to be collected and then sort of dumped in a field somewhere, and dogs are going to pick through it and so on, in many cases, women and girls are not going to be happy with disposing of waste into a dustbin if they know that it could be that their pads could end up exposed to the world and so on. So just we really do need to think about waste management all the way through to the final destination. And I have to say that we didn't find huge numbers, aside from some incinerator examples. We found limited examples really about waste management systems that had been designed with menstrual materials in mind. Of course, we expect that menstrual materials will probably be commingled in with other waste streams from the camp or community, but we still need to think about sort of how that is disposed and whether it's in a culturally acceptable way. So that's waste disposal. Bearing in mind that all menstrual materials are going to need to be disposed eventually. Some, of course, are disposable materials which are disposed after a single use, but even reusables will probably need to be thrown away after 6 months or a year or whatever. And so disposal is always going to be important, regardless of the situation. And if we ignore it, we risk clogging pipes and so on. But of course, when we are issuing reusable pads or reusable materials, then that also brings in more issues around laundry, washing, and drying. So if we can go to the next slide. This is we feel that there are kind of 4 components that we need to consider when designing wash response in a situation where people are generally using reusable materials. Short-term storage, in terms of, especially if people are away from home at school, for instance, and they need to change their pad. It's challenging to know if there's no water or soap at the school. It's challenging to know what to do with that, used menstrual material until you get it to a point where you can wash it. And I think we've found many cases where if women and girls are not able to wash a reusable pad or don't know what to do with it, they will simply dispose of it into the latrine or whatever, because they have very few other choices. So, not thinking about this does kind of affect our NFI strategy, because if we're issuing reusable materials, assuming that they're going to be used for 6 months or a year or whatever, but in fact they're being thrown away much earlier than that, that's going to have an impact on our ability to cover needs. So short-term storage certainly is something to think about. Washing, where do people wash? Do they have the supplies and the facilities that they need to be able to wash the privacy that they need? And then how are they going to dry them? And then finally, the other component is monthly storage, so that the pads are available next time. If we can go to the next slide, there's a great example from CARE in Bangladesh, where they were setting up laundry spaces within women-only spaces or women-friendly spaces. So the space itself was already kind of screened from the male gaze, and then these facilities had like laundry cubicles where there were things like shower curtains, which could be drawn or not drawn, depending on whether women or girls wanted privacy or didn't want privacy. And so there seemed to be good. That's good feedback from that project. We did, and as you can see, there are also drying lines within that screened area so that people can hang up underwear and pads and other things away from the wider gaze. Again, we didn't find as many different diverse examples of solutions to these problems as we would have liked. We did find challenges, certainly. I mean, and there's sort of a dichotomy between people wanting to be able to wash and dry their clothes, their pads and their underwear and so on at home, where they kind of were, I mean, in sort of the quote unquote privacy of their own home, even though many homes are not that private, and to be able to hang them up close to the home. And whereas others kind of, again, because of privacy issues in the home, others wanted sort of screened facilities like these ones and to hang them up there, but then hanging up pads and underwear in this sort of conditions can result in possibilities of theft and so on. Anyway, I mean, it's an ongoing discussion, which I think is going to be specific to each context, but that question about whether we should be providing public laundry facilities or helping to facilitate laundry at or near the home, I think is something to be considered in program design. And I think there's no one right answer, but it's not, some solutions seem to kind of neglect really thinking about what works best for women and girls in that one place. So yeah, I think there's a lot more to be done in the laundry and drying space. If we can go to the I suppose I take
David, you're breaking up. I think maybe if you remove your video, we'll be able to hear you again. All right, David seems to have a connection problem. So
You're muted right now, David.
Hey, okay, sorry. I'm sorry about that. I dropped internet somehow. How much of that did you miss? Quite a lot.
Just the last slide.
Okay, all right. So just to briefly wrap up, just to say that, you know, the compendium was co-published by 16 organizations, including IFRC and a couple of country organizations, Red Crescent organizations. You know, please do take a look. I will post the link to that on the website since it's not anywhere in the presentation, I'm realizing. The compendium is a bit of a snapshot in time. We hope that, you know, solutions will continue to develop and to get better, and so that future compendiums will be much bulkier, but we did our best to find all the solutions that we could find out there. And yeah, we hope that this will help us to think through future programming and move this issue forward. Thank you very much. I think that's it from me.
Thank you so much, David. So as usual, we're going to proceed now with the poll before proceeding to the Q&A. So here's your third question of the day.
All right, we've had close to a minute to answer the question, so let me publish the poll. Here we go. It's very close, but it seems that the major challenges are in collecting the waste and getting them to the final disposal location, and the actual challenges with being able to dispose of it, but having access to an incinerator or another form of a disposal mechanism. And about 22% of you also recognize that it's difficult to maintain facilities and maintain the disposal there on a frequent basis. So thanks for your input, and I hope also for David this might be useful in trying to understand what the challenges are that organizations are coping with. And with that, I would say we go to the questions. Laetitia, do you have a first question from the audience?
Yes, I do. Thank you. So the first question, if I'm correct, is from Annette, who asks, why does it need to be discrete, considering that we could add to the taboo with being actually too discrete?
Yeah, that's a great question, Annette. Yeah, I mean, I think, you know, put it back to everyone else really I don't have a definitive answer to that, because as you say, we do need to be breaking taboos, not building them. I mean, I guess one pragmatic answer would be that if it's not discrete, people might not use it. I mean, we've certainly seen examples in our own programming in ISE that if we provide a cubicle, which is kind of like, it's labeled the MHM cubicle because it has, you know, water inside or particular facilities, that there's a tendency for women and girls not to use it because they don't want to kind of signal to everybody that they have their period. So I think, yeah, there is the risk that if things are not discrete and they don't meet people's needs, they won't use them. Whether, you know, what should be the approach in the long term about breaking down these barriers and whether we're adding to these barriers, I think it's a good question, but I don't have really an answer to that. And I mean, I think it'd be interesting to hear from others, but I don't, that's the best I can do. Thanks.
Thanks, David. There's a question from Rupert who asks if you have any data on quantity or volume of menstrual materials being collected to help in management and frequency of emptying regimes, as well as sizing of storage containers.
We don't, and actually that's something we're really interested in doing. So far we do not have that data, and we are kind of with Colombia, as we think about what we want to do next, we're certainly considering whether we want to try and pull together a project to quantify that and kind of monitor a latrine pit or a waste disposal system to see what does get disposed of within a toilet. I mean, I do want to say on that just briefly that pads are certainly not the only thing. If you don't have a menstrual waste system within the cubicle and you have a pit latrine, then people will throw stuff into the pit. And pads are certainly not the least of that. I mean, you get all sorts of things thrown into a pit. So a waste disposal system can help to divert not just pads, but other stuff out of the toilet as well, which can make it easier for wash actors in terms of desludging and rate of fillage. So we anticipate that if we do kind of try and work out what actually does get thrown away in the toilet, whether into a waste disposal system or into a non-waste disposal system, we anticipate that there would be a lot of stuff other than menstrual pads, but we do not know what the volume of fillage rate is apart from anecdotally. So I think it's really interesting to get data on that. So I'd encourage any research on that. Thanks.
Thanks.
Then there are a few questions on menstrual cups. David, have you considered what the potential consequence or influences are of the use of menstrual cups around waste disposal, the potential to reduce waste, but also in terms of the drying practices that you described? Did that feature into your research?
Yeah, I mean, the compendium certainly does talk about menstrual cups. I mean, at this, we weren't really advocating for use of one material or the other. I think we were saying that our wash programs need to be responsive to whatever types of materials are being issued. So, yeah, certainly there is some discussion of cups in the compendium, but you know, the compendium isn't really about the benefits or disadvantages of different types, but rather making sure that whatever is being distributed can also be managed, if that makes sense. Yeah.
All right, thank you. 𝗖ție, do you have any other questions left?
I think there's actually a few other questions in the chat, but maybe just for the sake of time, I would go to the third presentation, and then in case we can come back, and please feel free to continue asking the questions in the chat. If we have a chance to answer to you potentially in the near future, we'll do so. Thanks everyone. So I am giving the floor now to Simon, who already shared his screen. Fantastic.
Hello everyone, this is Simon from the French Red Cross based in Beirut. I'm a WASH regional advisor, and with me we have the key person with which all the menstrual hygiene management is happening in Iraq. Is my colleague 𝗖cie.
Hello everyone, I'm 𝗖cie from Iraq, Sinjar. I'm implementing right now MHM projects in Sinjar community.
Great, thank you, 𝗖cie. So what we will do, I'll present briefly the works of my colleagues in Iraq, and for the questions, 𝗖cie will answer them. Thank you. So we are going to take you through our little journey about menstrual hygiene management from the start to now where we stand with Iraqi Red Crescent in Iraq. So as a base, we use IFRC guidelines of menstrual hygiene management in emergencies, where the 4 key pillars are understanding the social norms around menstruation, adapting the wash infrastructure, toilets and showers, so that it's adapted for women menstruating, make sure that there are culturally appropriate products available for women, and that the women and girls can access the information they need. And we started this journey with a workshop training the 18 branches from Iraqi Red Crescent into a 3-day workshop, where basically you get familiar with what is menstrual hygiene management and how to use the 8 steps of the MHM guidelines that are in the picture above, available in many languages, including French, Arabic, and English. So a little bit of background in Sinjar. So about information from the focus group discussion, we noticed that girls are not told about their first period before it happens. It seems to be very classical. Our colleague from Pakistan just presented the same fact. As taboo interdiction, there girls and women are asked not to prepare food because they might spoil the food. And it's valid for Iraq, but also in Syria, from what we've gathered. Women are told by their mom not to shower during their period to avoid getting infection or cancer of the ovaries. And the information they're looking to get is about the process itself of menstruation and menopause. And as in many places, some girls avoid going to school when they are on their period. So this is for the information. And in terms of social norm, it was very interesting to measure what are the perception of menstruation and the interdiction before an intervention on MHM and after. So we had a CAP initially and a post-distribution monitoring that allowed to answer the same questions. And the only two questions I will present to you are, the first one is when we ask women what word corresponds best to having your period, we gave a range of options, and 75% said normal or healthy, while 25 or 30% said shameful, dirty, or unhealthy. This is before intervention. After, we just have a 1% of shameful, like a very, very little one. So the intervention did work into changing the perception. During your last period, did you leave the house? And this is a very complicated one. Only 22% left the house normally, when the majority avoided leaving the house, and 20% didn't leave the house at all. And after, so after discussion sessions, providing equipment material, we have 80% who left the house normally. And out of the girls and women who said they avoided or they never left the house, we have the vast majority avoided to leave the house because they couldn't handle the pain. In terms of wash infrastructure, so the area we are working was under a lot of trouble with occupation of Islamic State, and now people are returning to the villages that have been abandoned, and you can see a picture of what in some villages a toilet look like. They mostly change in the toilets, and water is scarce. In schools, toilets have no locks, not water all the time, and they are not separate between boys and girls, without being easy also, sorry. And they tend to put reusable pads inside the toilet that would clog. For materials, we had several projects or several iterations of the kit with systematic discussion with women and girls on what the kit content should be. So we found two trends. One, in some rural villages, some women were interested in reusable pads, which we did, and it was quite successful. We distributed Afri pads. And in urban settings and in schools, girls do prefer single-use pads. So this kit includes sanitary pads, underwear, soap, small plastic bag for the bean, lotion for washing yourself during periods, and a big bag to include everything. And on the bottom right, you have one of our colleague volunteer who is doing a post-distribution monitoring on the phone. And you will see that the items that I highlighted in pink were some of the failure of our first kit. Initially, first time we did it, we budgeted some money for the kit, and we didn't plan enough compared to the needs the women had. And they expressed very clearly what they needed. we had a restricted budget, so we ordered what we could. And during the post-distribution monitoring, women, when we asked, did you have enough material to deal with your period properly? And women did mention that no, they needed more pads, we didn't distribute enough. And they wanted lotion, and they needed a bin to put in their toilet. And what was interesting too, now we have a bag, so it's hard to see through what's in it. Initially, we distributed the kit in the cardboard, which girls didn't like too much in the school setting. So we are learning from our different experiences. As for the challenges the team faces in MHM, one is pain management. As you can see, 20% do not go out of their house because of pain. And we plan to intervene with health professionals to support in pain management. We realized that the focus group discussion and the IFRC guidelines work great in community settings with women, like you can see women gathered and discussing about the products on the picture. But for school, we didn't have a structured session instead of a leaflet and something participatory and fun for girls. So this is what our next step was, and I will present in the following slides. We do not know how to involve boys and men into MHM programming. We do include volunteers in some training and orientation, and we have events like Global Menstrual Hygiene Day that is coming up soon, where men are a little bit involved, but we do not have a practical hands-on participatory approach to it. And we are very keen to learn from other people's experience on this. And one of the things that was highlighted in the post-distribution monitoring was also that we did some distribution, like group distribution, and women went uncomfortable being seen going to the distribution place because it's very well known why they are going to this place. So we switched to door-to-door distribution. And as I was mentioning in the previous slide, some items were missing in the kit, and systematic post-distribution monitoring helps a lot improving the quality of our work. As in where we are coming from is like 2019, we pioneered the MHM with Iraqi Red Crescent in communities, and we were looking to adapt a solution for school to make it fun and interesting to talk about menstruation and puberty in schools. And this is where Rosie's World, which is a methodology developed by WASH United, comes into place. So Rosie's World is an educational guide developed by WASH United. So Ina is in the call, she might answer questions better than me. And initially it was done for India, Africa, so Uganda, Ethiopia. I know there's a version in French for West Africa, and now with their support we adapted it to Iraq. So you can see the girls look quite differently in each one. So it's 2 trainings of an hour each, where the volunteer will read a story and have some games with the girls, so that Rosie, this little 10-year-old girl, realizes that menstruation is a normal process, and then on the second session she will go herself through menstruation, and we try to develop solidarity among women for accepting this process as being super normal and a good thing. The expected results of this program is to shift the pain and embarrassment of being menstruating in the family and school place, like all the stigma, like abnormal, shame, lonely, discreet, restricted, to being a normal process, understanding what this process is, feeling that you're part of a community of half the planet who has gone at one point through menstruation, to stop being discrete and become more. Say that again. To be vocal about it and to break some barriers. How we did adapt the methodology. So we provided to the designer a few pictures of what schoolgirls would look like in Iraq, and the designer of Wash United provided us some different design for what the girl would look like. And then with all the volunteers who had been trained in the 18 branches of Iraqi Red Crescent all across Iraq, we had a questionnaire proposing different options of the look of Rosie. So one of the questions is which picture is the most similar to what you find in your governorate? And you have all the volunteers answered, and you have answer number 3. Number 4 was the most represented. And then the second one was, what are the pictures that are not acceptable in your governorate? And that allowed us to design the look of Rosie to be similar to what there is and acceptable. We also chose the outfit. Should it show the arm or not too much, the shoulders, and should we see the ankles? I think that's called in English. And now 3 weeks ago, with Basima, Renas, and Rasha, which are our colleagues in Iraq, we organized the first training of trainer in 𝗖ście for this Rosie's World. I was a part of it, and it was a really big success. Like volunteers were really interested, and we will be developing it in schools for MHM Day. So a little bit before, because MHM Day is on a Friday, I think. But we will have the volunteers to go out to do their 2 sessions in schools for MHM Day. If you want to go further, so in this presentation, you have a few links. So on this link, you will find the Rosie's World methodology. I was muted.
Yeah, you were muted.
Okay. So you will find Rosie's World available in Arabic and English at this link. On Wash United's website, you will find additional resources that I mentioned for Ethiopia, Uganda, Western Africa, and India. On the Watson Mission Assistant, you will find IFRC guidelines for MHM in emergencies. And lastly, you will find on this link all the content, agenda, presentation, evaluation tests for organizing a 3-day MHM workshop, and the resources are both available in English and in Arabic. Thank you very much for your attention. We are looking forward to hearing your questions. So you have our contacts here if you would like to reach out later. Thank you.
Thank you so much, Simon. So we're gonna proceed with the poll as usual. I think we can do it even if you're sharing your screen. Yeah, perfect. And then we're gonna proceed to the Q&A session as usual.
All right, so close to half of the room has voted. If you haven't done so, give you another 5 seconds to submit your vote. All right, let me publish a poll. Here we go. So the question was whether your country or national society distributes kits which include menstrual hygiene products, for instance, a menstrual hygiene kit. About a quarter of you said no, never heard of an MHM kit before. If that is the case, I highly recommend going, for example, to the 𝗖ție website from the IFRC that has more details on MHM kits. Some of you use the standard IFRC kit, but the majority of you have already adapted kits to the local context. Very glad to see that happening. With that, I think we can go to the first questions from the group. 𝗖ție, do you have one for us?
Yes, I do. Thanks, Adrian. So there's a, well, let's start with the one very much specific to the presentation. So there's a question that asks if you can also share some experience in MHM programming in the time of pandemic. So if you have some additional information from more recent activities.
Yes, sure, but we have to take in consideration COVID-19 prevention measurement, and that's why we have changed our SGDs to door-to-door visit. Visitors with as well as taking all COVID-19 prevention measures.
Okay, yes. Thanks, 𝗖cie. Sorry. Rupert is also asking, how do you think you will be able to engage men more in this context?
Actually, it will be great to do like this activity with men, but here in Iraq, and it's sensitive matter. We have to plan well for before organizing like this activities with men.
Yeah, thank you. But yeah, it's true that it's sensitive, as in many places we are not too sure how to do it. And so in our last meeting we had about this was one have a desk review of what are the approaches to men, so consulting what other people are doing, and then also have a focus group discussion with different groups of men to understand a little bit their perception before trying to set up anything.
Thank you. I have a question myself. Please, anybody else from the webinar, if you feel like you want to ask a question to the team, please do so in the chat. But in the meantime, one of the slides that you shared, I think this is very interesting, is you've been engaging a lot of different people, and you could show with the CAP surveys and the training how you changed people's perceptions on menstruation and their behavior by their ability to go out of the house. So changing this behavior, was it done, one, through Rosie's World, or were you using other kinds of information to do that? And two, how long was the time between the baseline and then the follow-up to notice this change in behavior?
So the measurement is the CAP was November 2019 and the PDM was June 2020. So I'm not very good at calculating this, 8 months, and the PDM was on 2 months after actual implementation.
Okay, great. We have a great suggestion from the chat on approaching men and boys. Alex from the Austrian Red Cross is wondering if you've asked women and girls what they think in how to address or how to approach men and boys.
Actually, we did like this activity. We asked women and girls about how the men and boys see the menstruation. Large number of them they think that the menstruation is something shameful and not unclean. Yeah.
Yes, very clear, and a very good suggestion to have a discussion with women, which we haven't done yet, on how we should address it with the males in their family.
Thank you. 𝗖ție, do we have time for more questions?
Maybe one more question if there's one in the chat. I cannot see it now. Do you see any other question?
Yeah, no, not necessarily. I can't see a new one. Let me see. Oh, there's one question, sorry, around can any of the presenters share experience on MHM and local governance? The problem may not only or majority be the lack of intervention, but the sporadic programming. So I think this goes to all of the presenters. If anybody would like to respond.
My camera is on, so we have a limited experience with that, and correct me, Bassima, if I'm wrong, but during last MHM day, or the one before, we had local city representative, community representative offering their meeting room so that we could have the session on MHM day. That was our only local governance initiative.
Yeah, correct.
So you would like more interaction with them and more participation? 𝗖ție, over to you. I think we are ready to wrap up, no?
Yeah, that's perfect. Thank you so much. So just sorry, because I wasn't the one sharing the screen. Yeah, let me just share the screen again on the correct slide. Basically, before letting you go, we just would like to share some take-home messages that we thought are important to get away with. So the first one is really understanding the sociocultural context is key to designing and implementing successful MHM actions. And I feel this is something that applies to any project or any intervention we have talked about, but if we really want to exemplify it, thinking about the case study in Pakistan, think about how they had to change the pad from being a reusable pad to adapting it to the fact that that the local population wasn't using any underwear. So that's a very interesting example of this. Then always consider the fact that creating spaces such as MHM corners will allow women and girls to feel safer. Indeed, don't take for granted that women feel confident enough to actually talk about menstruation, and creating spaces will allow them usually to do so. Another important point is that MHM is a cross-cutting issue, so make sure your project addresses all key components from access to wash infrastructures, MHM items, and material, as well as information. And this is something that also David was reminding us today, that also for menstrual disposal, this is really fundamental. Then make sure to identify influencers or community leaders that are MHM champions who can generate community support for improved MHM. As we saw with the Pakistan example, this can be very useful to generate support for improved practices in menstrual hygiene management. Also, while conducting assessments and monitoring, always, yes, of course, consider doing quantitative surveys to understand, for instance, the number of women you're talking to, but always remember that qualitative research methods will allow you to understand better local needs, or in other words, will allow you to understand the who and what of the project you're really implementing. And this is something, for instance, that with Rose's World, we saw in Iraq, but also with the adaptation of MHM kits It's always good, of course, to have a standard kit, but then it's always fundamental if we are able to actually adapt them. Another fundamental point that we always mention, of course, men are important for successful MHM. Involve them at every step of the program cycle. They are fundamental also to defeat taboos that are related to menstrual hygiene management. So it is fundamental to have them on board. Finally, waste management, maintenance, communication, and a discrete design are 4 essential elements to successfully dispose menstrual waste in emergency context. So this point is really to always mention that these 4 points have to be taken into account altogether, because waste management, maintenance, and a discrete design without communication won't be as successful, of course, if the population in question doesn't really know what to do with this. So these are our take-home messages. I hope that you enjoyed our webinar. I just wanted to conclude this session by reminding you that if you do connect to our learning platform, which is free, you will have a chance to access our newly created playlist with all the recordings and the PowerPoint presentations that we present to you over time. So there's now, of course, the first 2 webinars, the first 2 PowerPoints. We're going to add this webinar and this presentation in the next few days so that you can have access to it. The link is shared to you in the chat as well by Adrian. I think I can't see the chat, but I'm confident that you have it there, by Adrian and Alex. So yes, we recommend you to subscribe to this platform, also because you have access to a lot of content and in this community of practice, especially on menstrual hygiene management. Thank you all again for joining us today, and I wish you a good day. Thank you.
Thank you very much. Bye-bye.
Thank you.
Thank you, everyone. Thanks all the presenters. Thank you, 𝗖cie.
Thanks, everyone.
Thank you. Goodbye.
Thank you.